Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome back to another episode of the Higher Powered Podcast. Today, I'm going to spend a little bit of time talking about functional strength training. Now, what is functional strength training and what exactly does it do? Functional strength training is a type of exercise that focuses on building strength to improve the way that you perform everyday movements and tasks. The benefits are that it trains multiple muscle groups at once, not just isolated muscles. So if you think about like doing bicep curls or tricep extensions, like those are focused on just one muscle group. Bicep curls are doing basically just the biceps. Tricep extension, just the triceps. If you're doing like a hamstring curl, that's just for the hamstrings. Whereas functional movements or functional strength training focuses on movements or exercises that hit multiple muscle groups at the same time. Some more benefits of it, it helps build balance, it helps build coordination, stability, and mobility along with strength. And it really just builds a foundation of strength for athletic movements and performance. It's kind of this almost like a catch-all where like if you're an athlete, like these are the foundational movements that you are going to be doing in sports. And then, you know, depending on the sport, you have like different movement variations that come from that. But even if you're not an athlete, if you're just someone who's looking to get stronger or stay healthy and exercise, like these are really good because, again, they work multiple muscle groups. They have many benefits for the types of exercises that you're doing. And the big thing is that it mimics real life movements. The functional movements of the lower body, we're talking about squats, lunges, steps, and a hinge or a deadlift. So just to put this in like real life context, how many times do you like have to squat down to either maybe pick something up or get something out of the lower cabinet in the kitchen? Lunges when you're maybe tying your shoes and getting back up. If you have stairs in your house, like there's steps. And then a hinge or a deadlift. Think about any time you pick something up off the floor, like, you know, whether it's your shoes or a kid or, you know, anything you're picking up from the floor is really generally going into that hinge or deadlift pattern. And then for the upper body, it's a press overhead, a push, a pull, and a carry. Think about like reaching up in the cabinet to grab a dish or a glass or something like that. Or if you're, I'm in my basement right now, if I'm reaching up into storage and grabbing something with a little bit of weight, that's going to be that overhead press, or putting something back up there, that's going to be that overhead press. A push, if you think about like in the gym setting, more like a bench press or like a chest press. In real life, if you're pushing a door open or a revolving door. A pull, if you're pulling a door closed, or trying to think of something else I might pull. I'm not thinking of anything right now. And then a carry. How many times you're carrying groceries, you're carrying something around the house for yard work. So these are all things that you have seen or maybe have even done in the gym as exercises, but they carry over into like what we're doing in everyday life. So it's not just like strength for the sake of being strong. It's strength to actually help us make our days a little bit easier. So why is this important? At bare minimum, the health benefits offered by consistent exercise. The World Health Organization and American College of Sports Medicine set these guidelines for exercise. We should be aiming to get 150 to 300 minutes per week of moderate intensity aerobic exercise, or 75 to 100 minutes per week of vigorous intensity aerobic exercise, as well as 2 days per week of strength training exercises. Why, you may ask? Well, the health benefits, mental and cognitive health, let's look at that for a second. Reduces getting exercise, and especially in that amount or that dose, helps reduce symptoms of anxiety and depression, helps improve mood, self-esteem, and sleep quality. I can attest to sleep quality. I have been trying to prioritize and focus a little bit more exercise in the past couple months, and my sleep quality has actually improved drastically because I don't know exactly all the benefits, but I do, or all the reasons, but I do know that exercising does help sleep quality. It does enhance your cognitive function. That means memory, your attention, some of the executive functions of your brain, and it may lower the risk of dementia and Alzheimer's disease. If you look at the cardiovascular benefits, consistent, regular exercise helps to lower blood pressure. It helps improve cholesterol levels, helps to enhance your heart function. It improves your insulin sensitivity and helps regulate your blood sugars, and therefore reduces the risk of heart disease, stroke, and type 2 diabetes. As far as your musculoskeletal system, how that benefits from exercise, well, it seems pretty straightforward, but it increases your muscle strength, your endurance, your power. It improves bone density, which is especially important for preventing osteoporosis. It enhances your joint flexibility and your range of motion, supports better posture, balance, and coordination, especially in older adults, and reduces the risk of falls and fractures. We can keep going with the health benefits here. Talking about weight management. Exercising consistently helps maintain a healthy weight. It helps support fat loss and preservation of lean muscle mass. It helps increase your resting metabolic rate, especially through strength training. And then, looking longer or down the road in life, it helps prevent some of these chronic diseases that are so prevalent in our society, such as type 2 diabetes or high blood pressure, cardiovascular disease, certain types of cancer, especially breast cancer, colon cancer, and endometrial. It helps with osteoarthritis and even chronic respiratory diseases. Now, it's going to change a little bit depending on what stage of life you're in. For children and adolescents, functional strength training really helps support healthy growth, learning, and social development. I would lump in just exercise in general for that. For pregnant and or postpartum women, it helps reduce the risk of gestational diabetes, promotes healthy weight gain, improves mood, and supports postpartum recovery. Just a side note here, like when people are going in for surgery, we always say the stronger you go into surgery, the stronger you come out of it. Well, the same thing is true for pregnant women. The stronger and more fit you are going into your delivery, generally the easier or the quicker your recovery will be, because you'll already have that baseline of strength working for you. Now, again, I have to throw this disclaimer in there. If you are pregnant and wanting to exercise, you should not just take this podcast as medical advice. You should reach out to a provider that you know, like, and trust to get maybe a little bit more specific recommendations. But again, just in general, exercise for pregnant women and postpartum women is a very good thing. And then for older adults especially, it helps preserve mobility, it helps reduce your risk of falls, and it helps maintain your independence for a longer period of time. There are so many aging adults that make it clear that they do not want to end up in a nursing home or assisted living. Well, this is one way that you can help yourself prevent that scenario, is prioritize some strength and some musculoskeletal strength to preserve your independence so that you can take care of yourself for a longer period of time. Someone said this to me before, and it has stuck with me ever since. If you could put the benefits of exercise into a pill, everyone would take it. But because you have to work for it, nobody wants it. And I think that's powerful because, like, exercise offers us just about everything we want physically, but nobody likes to do it because it takes a little bit of time and effort. And listen, I can relate to that. I'll touch on that a little bit later, but I just thought that was something interesting to share. So going back to why this is important, I actually learned this answer during my inpatient rehab rotation in PT school. The inpatient rehab, this is people who leave acute care in the hospital and they stay at a rehab hospital because they're not yet functional enough to go home. And I'll tell you, we were not using barbells and dumbbells and plyo boxes in the acute rehab setting. But my clinical instructor, shout out Kevin Freitas, said something important to me. He said the reason why it's so important to help others get stronger is because it is inevitable that sometime in our life we are going to get injured or very sick, and we need to be strong enough that when that happens, we don't dip below that threshold where we can't take care of ourselves anymore. Those who dip below that threshold end up in the hospital. And I feel like that's the most simple way to explain the importance of why we need to stay strong, especially throughout our lifespan. Then during this rotation, I mean, we were doing very basic things like sit-to-stand exercises, taking the patients to the staircase and have them do as many steps as they could before they need a break, picking up items from the floor. And this was just like the very basics of life and movement, but prescribing it in a way to build their capacity to be able to do what they would need to at home so that we could justify sending them home. This was quite literally the bare bones of exercise. But the fun part of it was being creative and disguising it at times, but also to make that 30 to 60 minutes like the most fun that they would have in a day. Again, shout out to Kevin Freitas, who probably does that better than anybody. Now, I want to talk about some objections because you might be listening to this, you might be thinking, oh, well, I can't do this because of X, Y, and Z. So I'm going to take some of the most common ones and kind of break it down a little bit. I don't have enough time. Now, again, I said I would get to this, but admittedly, this is the hardest one for me. I have a full-time job, this PT side business that I've started up and is growing, this podcast that I do, and I'm married with 2 kids under the age of 4. So time is a really tough one for me. And I bet there are a lot of others who are in an even bigger time crunch than I am. I probably hit the recommendations for exercise. If not, I'm probably close-ish. But being a former athlete, I don't come anywhere close to where I want to be from a strength and conditioning standpoint. I tried waking up early before anybody in the house is awake, and I just could not sustain it. I am not a morning person. I am not, especially first thing in the morning. After the kids go to bed is generally time for my wife and I to spend time together. But over the last couple weeks or couple months, as we've both been trying to prioritize exercise a little bit, when the kids go to bed, sometimes we will go down and exercise together. So on the days that I don't have a formal workout, I try to fit exercise into what I'm already doing. For example, if I take the kids to the playground, I'll maybe do some step-ups on the playground equipment while they're running around or, chasing each other or whatever the case may be. I'll step up on the platform. I'll do some calf raises there or on the stairs, on the curb. I'll do some hangs from the monkey bars. I'll do some single leg balance in the mulch. So that's kind of how I work it in when, I have to be watching the kids and, attentive, but still trying to get some work in. When I'm at home, I'll do things like I'll hold my youngest over my head while I hold a lunge, and then I'll bring him back down and he'll smile at me and toot, and then we'll do it all over again. When I'm walking up the stairs, sometimes I'll do like crossover step-ups because I know that they have better glute activation. Do I look like an idiot most of the time? Yes. Am I also trying to get a little stronger and be a little healthier? Also yes. The next objection that I hear this more from females, and that is that I don't want to lift weights because I don't want big muscles or I don't want to be bulky. A couple things to consider here. women have less testosterone than men. Testosterone is a key hormone for building large muscles or to get those bulkier muscles. Women naturally produce much less testosterone than men, about 10 to 20 times less. This means that women tend to build lean and toned muscles, not necessarily bulky in size. And that's even with consistent strength training. The bottom line here is that it's very difficult for women to gain muscle mass in the same way that men do without extreme training and like really specific diets. So for the most part, the fear of becoming bulky, generally that doesn't happen unless you do like super, super specific things to make that happen. Building visible bulk takes extreme effort. So think about like bodybuilders and stuff, and there are a lot of women that compete in that, but they are doing these highly, highly specific things. Women who look very muscular like bodybuilders follow highly specific programs. They have very strict eating schedules, specific supplementation, and heavy lifting for years. Like this doesn't happen overnight. This is like years of doing this. That level of muscle growth doesn't happen by accident. It is very intentional, and it's not very common. Strength training helps burn fat. Muscle is metabolically active, meaning it burns calories even at rest. Lifting weights can speed up your metabolism, leading to fat loss, not necessarily bulking up. Here are a couple other considerations for people that are in pain. People say, I'm in pain, I can't lift weights. If you can stand up from a chair, then you can squat. If you can go up and down stairs, then you can do steps. If you can pick something up off the ground, you can deadlift. If you can tie someone else's shoes, then you can lunge. If you can raise your hand, you can do an overhead press. If you can pull a door open, you can do rows. If you can push a door open, you can do a chest press. If you can carry your groceries from the car, then you can do carrying exercises. These are all the most basic things you do each day. The only difference in functional strength training is that you incorporate the lowest amount of resistance that will actually make you stronger. You perform these movements within a range of motion that is enough to challenge you, but not enough to make your pain worse. So if you can't go all the way down into a squat, then you just go to where you can pain-free, or like I like to tell the people that I work with, just go until you touch the pain and then come out of it. You don't have to use the excuse that I can't do a full rep or go through the full range of motion, so therefore I can't exercise. You can. You just might need a little bit of guidance, and you might just need certain parameters to help make that a little bit safer and a little bit more tolerable for you. This is how myself and people that do that work in a similar niche as me, this is how we program to help you restore functional strength. Just because you can't tap your knee to the floor on a lunge or step up like a tall step onto your porch or pick up a 30-pound bag of dog food from the floor doesn't mean that you can't lift. You can do it. You just need a little guidance from someone who knows how to provide graded exposure to different movements and graded resistance to help you restore your confidence and your body's resilience to these movements. And I emphasize the guidance part, especially if you are new to this or if you haven't been consistently active in a while. The last thing I want is someone to go from 0 to 100 and then their tendons and joints hate them and it's my fault. So please, if this is you, consult with a professional before diving in on your own. Just a quick offer here. If you're listening to this and you are interested in getting back into exercise, if you need a little bit of guidance, if you have some pain but you're not sure how to, exercise without making it worse, if you're looking for a specific goal through exercise, that is very much what I do. That's very much what I specialize in. I have worked with a number of people all throughout the spectrum of new to exercise, wanting to make a lifestyle change, or very experienced with exercise, but they're still having some little issues or little problems that they're dealing with. That's exactly what I do. That's the space that I operate in. And I would love the opportunity to help you so that you can exercise safely, that you can get all the benefits that I talked about with exercise so that you can get them for your life. You might just need a little bit of guidance. And I can't tell you how much guidance you'll need because I am speaking to whoever is listening, and whatever you need is going to be very specific to you. But I just want you to know, if you're listening to this, I'm here to help you. And I would love that opportunity. And just please, please, please don't hesitate to reach out. That doesn't mean that you have to work with me formally and sign up for a plan and spend tons of money. Even just the conversation, I'm willing to point you in the right direction for where you want to go, whether that's with me or anybody else. So please, if you're listening to this and you are interested in anything that I talked about, please don't hesitate to reach out. Hopefully that helped give you a decent understanding of what functional strength training is, a little bit of how I incorporate it into the people that I'm working with, of all ages, athletes through older adults. But that's going to be it for today's episode. Thank you all for listening. Again, if there's anything I can do, please, please, please do not hesitate to reach out. You can find my information and ways to connect in the show notes. Thanks again for listening, and we'll see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.